Good morning, everyone. Welcome to the Utah Healthcare Association Emergency Preparedness virtual webinars. We put on events like this every year to go over our current topics in emergency preparedness, to make sure that our facilities are up to date. And if you guys have any questions about emergency preparedness or anything that's required for your facilities, please feel free to reach out to me. I'm a resource for that, and if I don't know the answers, I will absolutely find them out. We have a really great lineup. So over the next couple of weeks, we're going to have some great people talking with us. So today we've got Dan Wilder, and I believe next week or the week after, we've got Stan Spatek. And I hopefully said his name right. That one's a hard one for sure. And then after that, we've got Steve Wilder as well. We've got, these guys are just industry experts, and I'm really excited to have all of our different sessions that we're going to be talking about over the next couple of weeks. So just as a reminder, it'll be every Thursday for the next 3 weeks. And then next week, I will be sure to send out the link as well so that you don't lose it, or just so that it reaches the top of your email again, so it's easy for you to access. How it's going to work today is we will just have this session and it will go until 11:30, but we will leave some time for a Q&A at the end. But if you guys do have questions in the meantime, please feel free to put them in the chat. I will be monitoring the chat the whole time. So if you guys have questions or whatever, please put them in the chat and I'd be happy to facilitate that over to Dan. One thing just as housekeeping items that I wanted to mention is our spring conference. We have that coming up. We have registration, early bird registration opening next week. So it opens on the 14th. And I'm really, really excited. So this is our conference that we do down in St. George. And this is for all of the administrators and directors of nursing, just leadership in your building. So we're going to be talking a ton about just leadership and how to be a good leader, different qualifications of being good leaders, how to have difficult conversations with people, with employees, and just really great leadership discussions. We also have the mascot from the Kansas City Chiefs coming to our event. He's going to be speaking. He's got a really great story. And he is a very motivational speaker. So we are super excited to have him come. So he's one of our keynote speakers, and we've got a couple of other ones as well. So make sure that you guys are registering for that. Early bird registration opens next week. So keep an eyeball out for that. So we have Dan Wilder here today with us. I'm really excited. Dan is an industry expert, and he is obviously has all of the information about this. So today we're going to be talking about the essentials of aggression management in skilled and assisted nursing facilities. Dan Wilder has been with Wilder at Sorensen, Wilder and Associates. And he's been a firefighter with the Village of Bradley in Illinois for 24 years. And he's been an industry expert educating for the last 18 years with Sorensen, Wilder and Associates. So we're super excited to have you, Dan. And I'll just kind of let you take it away and give yourself a more in-depth introduction. But again, if you guys have any questions throughout, please feel free to put them in the chat and I will be here. And for those of you guys that are, sorry, didn't mean to cut you off, but those that are just joining, please make sure that you are matching your name on your Zoom so that I can get your credit for your CEUs. So Dan, I will let you take it away.
All right, thank you, Brittany. And I do got to admit, the first time you said the mascot from the Kansas City Chiefs was going to be at your conference, I thought, that's amazing. She got Taylor Swift to come to the conference. So
oh my gosh,
that's
wish.
awesome.
I'm a huge Swiftie, so I wish, but maybe he can put in a good word for us next year.
There you go. Maybe she could just fly by and wave or something.
Yeah,
so
exactly.
All right. Well, thank you very much for having me here. It's a pleasure to do this webinar for you. I am very passionate about workplace violence and managing aggression. I have been teaching this program going on 18 years now. I have been part of this program for 24 years. When I first started in the fire department, I was 18 years old. The training that we got for dealing with aggressive patients in the back of an ambulance was a version of this program, and it hit home the first time. Just, just learning how to talk to somebody is such an imperative. It's so important to just managing people's aggressions and helping set expectations of what's going on. So uh, you're going to learn a lot in the next hour and a half. And if you do have questions, I will stick around as late as you need to answer those questions. I have nowhere else to be today, so I'm here for you guys. At the end, there will also be my phone number and email address. If you do have any questions, I'm happy to get those answered for you right away. So uh, a little bit about me. As Brittany said, I started with our company in 2006 with a degree in law enforcement. Originally, I was going to be a police officer, which drove my entire family nuts because I came from a family of firefighters. But as I continued to go through and test for departments and intern with this company, I really I fell in love with it, and I loved teaching, and I loved being around people, and just working with the family business every day it was a pleasure to work for. So as I continued to test, and I said, I'm not sure I want to do this, an opportunity came in, and uh, work for the company, and I've never looked back. It's been a great ride. So as Brittany said, I've also worked with the Village of Bradley right out of high school, retired last Monday after 24 years. Did a lot of training with them, was a part of the uh, fire academy there, and I helped train with their academy. I'm a certified member of the Illinois Fire Instructors, and when I do teach, and I still will be coming back to my department to teach this program because, again, it's something that we believe in. So the first thing I want to do is start off with a question for all of you. And now I don't need any answers or anything like that. I just want you guys to put it into your mind. Think about, have you ever been the victim of workplace violence? And I ask this everywhere I go, every training I conduct. And this is the way I start out every one of my programs. Because a lot of times I'll hear people say, it's not really something we have to deal with here. It's not really something where we see a lot of. But lately, in the last couple of years and everything since COVID, we have seen a tremendous increase in workplace violence in the healthcare and social service setting. Uh, Working in assisted and working in skilled care, those are all part of the healthcare industry. So we've seen that. And in a minute, we're going to go through the definition of workplace violence. And I'm going to ask that question again. And I bet you your answer changes. So we're going to talk about the impact of workplace violence. What is it? What is the impact for you as a person? But what about your company? What about your coworkers? And then we're going to talk about the role of de-escalation and managing aggressive and disruptive behavior. So I know this stat is a little bit dated, but in 2015, nursing and residential care facilities were among the industry's highest prevalence of non-fatal occupational violence, with a rate of 6.8 per 100 full-time workers. 35% of nursing assistants reported physical injuries resulting from aggression by residents, and 12% reported experiencing a human bite within the previous 12 months. If you've ever been bit by a resident or a patient or anybody other than your own child, it's a very painful thing, and the treatment for it is even worse. And so we do spend a little bit of time when we teach this program in person, how to escape if somebody does bite you. So, on a side note, one of our coworkers here, his wife is a traveling nurse, and she goes to different skilled nursing facilities, and just talking to her on just about every one of her shifts, she's having somebody attack her. And so when you see this and you see, oh, well, that's 2015, that's dated. It is still happening every single day. When I'm traveling with her husband and they're talking on the phone, she says, oh yeah, I got punched today. Oh, I only got spit at once today. It was a good day. CNAs provide 80 to 90% of direct care and are 23 times more likely to experience aggressive behavior from residents. one thing to really understand when we're talking about workplace violence and de-escalation, we are not talking about active shooter response. Active shooter response is something that is completely different. And we never want to try to de-escalate an aggressive person. I'm sorry, an active shooter. They come in with a gun, we're going to go to a whole different response. We do not want to try to de-escalate that person with a gun because they're not coming in to talk. They're coming in to kill as many people as they can. De-escalation stops when we see a gun. So, as I said, we're going to look at this definition. So, what is workplace violence? In simplest terms, any incident in which an employer or employee is threatened, intimidated, physically or verbally attacked, harassed, injured, or killed has been the victim of workplace violence. So think about your last week at work. Have you been threatened by somebody when you were at work? Have you been intimidated? Have you been verbally attacked? Let's just say verbally before we get to the physical part. Have you been cussed out or screamed at? Have you been harassed? If you're on here, you haven't been killed, but have you been injured? If you say yes to any of those, have you been spit at? Have you been bullied? Have you been stalked online? All as a part of your job. That is all part of workplace violence. So in that first question, if you thought, no, I've never been a victim of workplace violence, but then you go, oh yeah, I've been attacked. I've been verbally attacked. I've been spit on. I've been pushed. I've been scratched. Then you have been the victim of workplace violence. So incidents of workplace violence can be avoided. And a lot of times I'll work with the my fire department after a violent incident on the ambulance. And one thing I hear all the time, Dan, 1 minute we were talking and have a conversation, and the next minute they were growing lumps on my head. No, usually that doesn't happen. There are steps, there are signs that a person presents. You just didn't recognize them. And as we go back and we kind of Monday morning quarterback with them, they start to see those signs. They go, oh yeah, I never would have thought of that. So to increase our safety and lessen the chances of being injured, follow some guidelines. First off, limit physical intervention. Anytime I can de-escalate a person, there's 100% chance I'm not going to get hurt. If I don't have to put hands on them or they don't have to put hands on me, then I don't have to worry about getting injured. Limit physical intervention. Don't let it get to a point where they become aggressive. Use an adequate number of staff. I can't tell you the number of times I've gone to a call where we get there and there's 3 police officers screaming at this person to complying to do something. And they're all yelling at them at the same time. They're all barking different orders. Get down on the ground, put your hands in the air, interlock your fingers, stop resisting. They're not resisting, but who do I listen to first? And as soon as we can get them people, the police officers out of the way a little bit and talk to them with just one person talking and 2 people protecting me in the back, we can usually de-escalate. I always compare it to when I first get home and both of my kids come running up to me and they start screaming and asking me questions at the same time. It's like, whoa, wait a minute. Give me 1 second. Let's go one at a time. You talk, then you talk, and we'll get it all sorted out. Same thing what happens here. Develop and train emergency response teams. A group of people that are trained specifically for dealing with aggressive people. They go through a little bit more detailed training than what we're going to go through today. We spend a little bit more time on de-escalation. They practice it a lot more, and they're really good at getting in there and just de-escalating. Okay. Provide training to all employees. This is critical because anybody can become a victim. Anybody can come in and just rub somebody the wrong way. And so much with de-escalation and keeping a person calm is good customer service. So we need to train that to everybody. So everybody in the building not only knows what to look for, but knows what not to say when a person is aggressive or getting angry. So use training and role-playing situations and mock drills. When you're doing a training and you're doing some de-escalation training, spend a few minutes with them and do the role play. And then watch what they're going to say. Watch how they react. Okay, could we have said anything a little bit different? Doesn't have to go real in depth. It doesn't have to take a real long time. 5 or 10 minutes a day. Once a week, we could do this and just go through some training and stop the training and go, okay, where are they at on the aggression continuum? How do we bring them back down to calm? Some characteristics of a potentially violent person. Now, I'm going to preface these next couple slides with a warning and say just because some of these characteristics show up on a person does not mean that that person is violent. But when you start seeing several of these characteristics, now they might be somebody what we want to worry about and pay a little bit more attention to. First off, a person, so there's 80% chance that the person will be male, 75% chance that they'll be Caucasian, and 90% chance that they're of working age. Now, working in skilled nursing or assisted living, that last one might not be as accurate because of the type of clientele you're working with. You may not have, or you may have somebody not of working age become more aggressive, especially if you're working in a dementia or Alzheimer's. 90% will display one or more of the following: pathological blaming, person that just can't take responsibility for their own actions. It wasn't my fault. I did this because you did that. History of depression. Being depressed alone isn't enough to make somebody violent, but their responses, especially if they're off their medications, their responses and their actions may be different than what we'd see in a normal day. Personality disorders. Most of you are going to be aware that a person with a personality disorder may escalate quickly and without showing a lot of prior warning. And this is one of those exceptions when I said usually they show signs. Personality disorders, they might not. A history of violence. I always tell my guys if they were violent before, there's a good chance they're going to be violent again. And we need to be prepared for that. So one thing I used to do, and when I retired, I was the official old guy in the department because I would come in, I'd work Sunday mornings. The newspaper would arrive on our step. I would get my coffee and I'd go sit out in the front of the station and I'd read the newspaper and drink my coffee like most old guys do. And one of the things that I would always look at were the arrest records. I wanted to see who got arrested the week before. Because anytime somebody who lived in Bradley was arrested for any type of violent crime, I would cut that name out and I would post it on the bulletin board. That's not any kind of privacy violation because it's public knowledge. It's in the local newspaper. But if we were going to that resident for any accident, person fall down the stairs, trip and fall, any of that kind of stuff, lift assist, anything that we were going to that person's house, we knew that there has been a history of violence with that person and go in there with a heightened sense of awareness. We're not going to go in there and expect them to be violent. We're not going to order that the police come with us and search the building first, but we are going to be a little bit more aware of our surroundings. Person with who shows evidence of erotomania. And erotomania is gaining sexual gratification from violence. And if it's not erotomania, maybe it's just somebody who finds violence as an acceptable way to get what they want. And if they act a certain way and the greasy wheel the squeaky wheel gets the grease, if I come in and I act a certain way, they're going to pay attention to me first, or they're going to do what I want and because they're afraid of it. When I was very young in the fire department, 9/11, I got out of school. They canceled school for the day. I went straight to my fire department and I grew up in that department. I've been there my entire life. Never have I ever heard that building that quiet. And as we're sitting in there and we're watching this unfold in the news, one of our probies comes walking in, and him and I were going through fire academy at the same time. So he comes walking in He sees it and he goes, "Oh, cool, I haven't missed anything." And he ran over and he grabbed a handful of popcorn and he sat down and he was eating popcorn like he was at the movies. We watched the second tower fall, and they're talking about how many people are in the building and the fear of the firefighters that are dead. And he looks over at us and he says, "Think it's too early to apply at New York?" And people were astonished. I mean, the silence of that department went from, you could hear a pin drop, to very vocal and very loud really quickly. Uh, he left the department that night. We never saw or heard from him again. He dropped his gear off of the station steps. No idea what happened to the guy. I've never saw him again. I actually can't even remember his name, but he didn't see that as a world changing event. He saw it as a way that, oh, maybe I can get hired on at New York. A person with an interest in weapons. Simply having an interest in a weapon does not make a person violent. There's a lot of people out there who have family heirlooms, that have firearms, that have medieval weaponry, whatever they collect as an interest. That's not enough to make them violent. The concern comes is when there's that unhealthy interest in weapons. Oh, I just bought a new gun and it can fire 500 rounds a second and it'll put a hole in you this big. You know, I once had a coworker who would tell me that if I ever had to terminate him, to pay very close attention because he could shoot me from very far away and I would never hear the bullet. That was a concern to me. But simply owning a firearm or having a sword or any of that kind of stuff is not something that really sparks my concern until they start talking about it as I could do a lot of damage on it. Chemical and alcohol dependency. When people go through some changes, they experiment with marijuana for the first time since they were kids, and now they're on vacation and it's legal here, so let's give it a whirl, and it affects them differently and they start hallucinating. Or the person who's going to have a few too many at their Super Bowl party tonight. It's that person who goes through those changes that concern me more than the full-blown alcoholic. Elevated frustration levels. Good people make bad decisions when they're frustrated. And we have a family member who comes in aggravated that mom's falling out of bed for the third time, and you better shape up or you're going to be the next one to fall. They're making threats to us out of frustration and worry of their parent. Normally, under normal circumstances, they wouldn't do that to us. But the frustration is building, and now they're starting to point fingers and figure out who's at fault. Impaired neural functions. Again, people who have had past trauma, stuff that has happened to them when they were at a war or any of that stuff, could have affected their brain and their cognitive processing, and they could be quicker to go to violence. And then evidence of psychosis. Again, somebody who may go to violence without showing a lot of warning signs. When we talk about workplace violence, as a person working in a skilled facility or a assisted facility, you guys see a lot of ugly. And nurse burnout since COVID it's a thing, and it's very scary. And you guys are all dealing with so much anger and so much frustration, and it's hard to keep that separated. That's where our personal face and professional face come in. Personal face or professional face is who you are while you're at work. When you put on your scrubs and you clip that name tag to your shirt, that is your professional persona. Everything you deal with during the day is happening to the professional you. The personal face is who you are when you're away from work. It's who you are when you're with your friends and your family, and how you act. And everybody acts differently when we're at work than as we do when we're at home. It's just part of the way that we are. These are how we keep them separated. When I first heard this, I had a coworker. He has since gotten married and retired out in Florida. And this time of year, he is not my favorite person, but he's still a great guy. And he's done a lot of help for us with this. And when he came in and he brought this with us, he would talk about this, and I knew it was my turn to take a break. So I didn't believe into any of this stuff. I didn't buy into any of it. He would talk about it. I let him talk about it, and I sat there and listened to him. And then COVID hit, and then my life was completely out of control. I went from traveling 6 months out of the year to being Mr. Dad. And, it was very, very, very frustrating. It was scary. I was working a lot of shifts at the firehouse because we were short staffed. And it was every day it was scary. And there was so much misinformation out there, and there was so much unknown. I was afraid to go home and hug my kids. I didn't want to be at home with them. I was showing all that frustration and all that fear towards them. Yeah. It got so bad that when I was getting ready for work, they would see it and they would start crying, and they would start, we don't want daddy to go. He's going to die. And it was hard to hear a 3 and a 5-year-old say that kind of stuff to you. And it was really starting to mess with me. And he called me up one day and we were chatting, and he made a joke, and I just came unglued and I spewed off a bunch of bad things, and he let me vent for a while. And he said, Dan, your faces are all messed up. He said, you have got to get your faces under control. He said, you're stressing yourself out so bad, you're going to put yourself you're going to have a stroke, and you need to just relax. And I said, yeah, that's easy to say when you don't have kids and you're, living the sweet life in Florida. And he said, dude, here's what you need to do. He said, I've been there. I did 20 years as a police officer. I've been there. Let's straighten out your faces for a minute. He said, right now, you don't have to worry about SWA. It'll be there when COVID is over. Just relax about that. Don't worry about it. He said, let's just focus on separating your fire department you from your home you. He said, I want you to go out tonight and buy a laundry bag. Just buy that bag. And then when you leave every shift, before you leave, he said, don't wear your fire department clothes to the station. He said, go there early, change into your uniform. That way, your kids don't see you getting ready for work. They see you as going to the gym, or they see you as leaving to go get a gallon of milk. They don't see you going to work. Okay, so now they're not going to worry so much about it. So when you get to work, take off your clothes, fold them up nicely, put them in your duffel bag. So then take out your clothes, your fire clothes, put them on, and realize that Family Dan is off duty. He's not there anymore. You don't have to worry about him right now. He's sitting in the bag waiting for you. Work your 24-hour shift. Let everything that happens to you, the name calling, the violence from the patients, the germs from the COVID, and all of that stuff, let that come to the personal Dan. You have the PPE to protect you. Absorb that stuff. So let the names absorb into your uniform. When you get done with your 24-hour shift, take that laundry bag out, shove all your dirty clothes into there. So take all that anger, all the frustration, all the anger from the day, along with the germs. He said, shove them in that bag. Seal that bag up, leave it out in the garage until you're ready to do your wash, and then wash them. And all of that stuff, all of that anger and all of that fear and all of the germs and everything else will die in your washer. And it will come out and it'll be a clean uniform that's ready to go back to work again. So once you do that, jump in the shower and wash all that stuff off you yourself. I know your department has a shower. Wash all that stuff off. And just decompress and let all that stuff go. As that water's running over you, it's washing away everything that happened. Put on your personal face clothes, back into your street clothes, and you leave and you go home, and you don't have to worry anymore about any of that stuff. And for God's sake, hug your kids. That was the last thing he said. He said, hug your kids. They need it. as badly as you do. And I really, the first day I didn't listen to him. I said, Glenn doesn't know what he's talking about. He's out of his mind. My second shift, I said, you know what? Let's give it a shot. And it was a good day. And it was like the old times again. And it was fun. And I had a good shift. And so every day from the day of COVID until my last shift, I did exactly what Glenn said. And my kids weren't scared that I was going to the department anymore. I wasn't scared that I was going to the department anymore. It saved my life. And it's a great way to say it. It helped me deal with my burnout. I didn't work any fewer shifts. It was just the way that I was acting as we went through that. So my point is, and I know that was a very long story, and probably some of you may have not understood it all, but find a way to balance your personal face and your professional face, and don't let them get messed up like I did. And I've talked to a lot of people, and a lot of people I talk to say they do the same thing where they change into their scrubs at work. There's one lady who said at the end of her shift, she takes off her name tag, she wipes it off with a Clorox wipe, and puts it in her desk drawer. She throws the wipe away. That's wiping away all of the anger and all of the frustration for the day. Another person I knew said they have a worry tree that they stand outside, and before they go in, they literally tell all their worries to the tree, and then they can go in. So just having a way to deal with your two faces, it's a great way to help keep you safe and keep you from burning out. So all of that was really the introduction to our aggression continuum, our 6 steps from calm to physically violent. So this program came about in the mid-90s when Steve Wilder and Chris Sorensen were working in the hospital setting. They did not have a program that they liked that was healthcare focused. And so they created this program with a behavioralist by the name of Dr. John Moran, who helped them create this continuum. So when they were creating the continuum, they believe that their best visual aid, their best choice to use when they're talking about rising aggression is going up the ladder. So they're using a step ladder as their visual aid. Step ladder is easy to think about. It's something that we all have. We've all climbed to them. Some of us may have fallen off of them a few times, but when we say we're going up the ladder, and you'll hear me say it a few times as we talk now the rest of the day, realize that means they're rising aggression. When we get to this step here, I think I can draw. No, I don't think I can draw. But we get to that 5th step. What does it say? Danger. Don't stand here. Not a step. We get to that 6th step, which is not a step. It's the top of the ladder. And it tells you, don't stand here. You're going to fall. Every step up we get 1 step closer to violence. Our 1st step, the person is calm. This is where we want to be every day. This is where, we woke up, we got out of bed, we grabbed a cup of coffee, we presented ourselves in a calm manner. We're not agitated. Their presence is not threatening. It's just another person functioning in society, somebody we don't mind sharing our oxygen. Your response: respect the person's dignity. Actively listen to the person's concerns. Demonstrate compassion and caring. Focus on their needs and begin to try to build rapport. Now is a great time to get to know this person. And you kind of have the advantage because you see so many of the same people every day, some of the same residents and the same family members. We can get to know them, and we can start building rapport with the person when they're calm. So when they do start to get a little bit agitated, you have that rapport to go back to and talk to them. And they know that you're there for the best interest of their family member. They know that you're there and you care, and they may be more willing to talk to you and tell you what the reason for becoming frustrated or agitated is. But this is where we want to try to keep everybody. But every now and then, some people have a bad day. And this is a good person having a bad day. Verbally agitated It is a non-threatening level. This person is no threat to us. They express verbal anger. We've all been there. The person is not agitated, or is not, their anger is not directed at anybody or any specific object. It's just, I'm having a bad day. The person is no threat to us. Our response is listen to their concerns. If we actively listen to what they're telling us, they will tell us what is wrong. But so often we don't listen as much as we just wait for them to stop talking. Demonstrate respect. Support the person's dignity and avoid giving orders. When you're having a bad day and you're really agitated and you're venting to somebody and they look at you and they go, you need to calm down. How does that make you feel? If you ever once went, oh my goodness, I was having such a bad day and I didn't know what to do, but now you told me to calm down. So thank you so much for telling me to calm down. That has never happened to me. I've never been that guy, but you tell me to calm down. And what happens? Don't you tell me to calm down. You immediately escalate because you're giving orders. Sit down and be quiet and we'll get to your parents as soon as we can. That's not the way we want to hear it. That's not the way we want to be talked to. Somebody who is verbally agitated wants to be listened to. So sit back and allow them to vent their anger. They may do it loud, but that's okay. Let them. I always equate this level, or this rung on the ladder, with a champagne bottle. If I have a champagne bottle and it's sitting on my desk, it's a champagne bottle. It's not at risk. There's no threat to it. But if I pick it up and I shake it up real good, what's happening? It's starting to build up a lot of pressure. And eventually that cork is going to pop off and all of that champagne is going to flow onto my desk. At that point, is there anything I can do to vent that champagne or to stop it from spilling out? No. If I put my hand over it or shove my finger in it or try to get the cork back in it, it's going to make a bigger mess. All I can do is stand back, wait, and let it spill out. And when it's done, all I have to do is come and wipe it up. We're the same here. We all have a champagne bottle. And if that champagne bottle gets shaken up, eventually it's got to vent. How does it vent? It vents by releasing the steam. All right. Now, some people vent at different speeds. When I get angry, I vent through an opening about this big. I say what I have to say. I vent. I let it all out. And then I go, hey, all right, I'm good. My wife, on the other hand, unfortunately, she vents through an opening this big. The whole time I'm venting through my big opening, she's having her bottle shaken up. And now she gets angry and it takes her a little bit longer to calm herself down. And maybe she vents for a longer amount of time. There's nothing wrong with either way. People vent differently. Our next step up is verbally hostile. This is when you start to wonder, how big is that person's champagne bottle? They've been venting for a long time. They're oblivious to us trying to calm them down. They're not, we're doing our active listening and we're trying to catch what's wrong, but they're not calming down. They're starting to show a higher degree of emotion. Maybe their face is turning red or they're starting to cry. They may be making fists. I worked with a girl that when she would get mad and she would get to verbally hostile, her face would turn beet red. She would start to talk and she would have to fan herself and take a minute because her body was just not able to talk anymore because she was so angry. Our point here now, we want to maintain a non-threatening body posture. So much can be said about a body posture. It's not, and I used to yell at my boy about this all the time, but it's not what you say, it's how you say it. It's not how you stand, it's the body posture of what you're saying when you do stand. And you walk into a room and you cross your arms and you go, what do you need now? Why do you keep calling that nurse call button? I'm busy. What do you want? And you're standing there with your arms crossed. Does that say that I'm open? No. It says you're a bother to me. So watch the way that you stand because it says a lot. Uh, I have two young daughters, and we would take them in to get their vaccines and their shots and all that stuff when they were younger. And there's one, the doctor's office is great, and we love all of the staff there. But there's one nurse that would come in to give them the shots, and they would walk in, and she would come in. She'd have both of her hands behind her back. She'd have a needle in one hand and an alcohol wipe in the other hand. And she would walk in, oh, hi, aren't you cute? And she'd act like she was pinching their leg. Well, what she was really doing was using the alcohol wipe to get her clean. And then before you knew it, bam, and she would walk out. And I mean, she was in and out in 10 seconds. She had the shot given, the Band-Aid on, and out the door within 10 seconds. But the way she came in with her hands behind her back, it made my daughters curious. And I walked into their room one night, and I'm tucking her in, and I had my hands behind my back just because it was comfortable. And she said, Daddy, what are you doing? And I said, tucking you in. And she goes, why are your hands behind your back? And I said, oh, there's nothing in my hands. She goes, oh gosh, I thought I was getting a shot. The fact that that nurse had her hands behind her back, now my at the time 4-year-old daughter thought, she associated that with anybody who having their hands behind her back. So if you go walk into the room and you have your arms crossed or their hands behind your back, could that bring them back to something else that make them think that maybe you're going to be giving them a shot or putting them into a restraint or doing something that they don't want you to do? Okay. Respect the person's personal zone. Keep at least one arm length away from the person. We can talk to them without being really that close to them, especially if they're agitated. They're verbally hostile. We want to give them a little bit of space. And if I'm trying to de-escalate the person and they're not de-escalating, I'm going to take a step back because maybe I'm still too close to them because different people have different personal zones. People who are veterans, who have been in the military for a long time or served as a police officer, may have a much bigger personal zone than other people. Allow this person to vent their anger. Again, they're still not doing anything wrong. They're just venting. They're just angry. They're still not a threat to us. At this point, though, we might need to start guiding them a little bit. And if they're out in the lobby and they're screaming at the front desk staff and they're making a big scene, do we want them there making that big scene? Or do we want to get them somewhere else into an office or into a quiet zone or somewhere where they can de-escalate without everybody else watching them becoming uncomfortable? Okay. But how do we get them to do that? Do we say, go over there in my office and we'll talk? Again, we don't like to be told what to do, right? So when we were creating this and Dr. Moran said, hey, keep your instructions minimal, they asked him that. They said, well, how do we do that? How do we get them to do what we want them to do, but not give them an order? I said, guys, it happens to you all the time. Ever try to buy a car? He said, oh yeah, that's true. They do. They, think about when you go to buy a car. You go up in there and you're on guard. You're ready to go. Nobody likes a car salesman. They're pushing. But their job is to get you to go in there from here to here and get as much money out of you as possible. So they spoke with one of their colleagues who sold cars, who owned a business. And they said, guys, it's really easy. So we ask them questions that they want to say yes to. Yes is a positive. Every time I can get them to say yes to something, I'm more likely to get them to sign on the dotted line. Every time they say no, they're more likely to walk away. So I don't ask any questions that says no, that has the word no in it. The next way I ask the question is I end the question with N''T. Doesn't it? Can't we? Wouldn't you? those kind of questions are more likely for the person to say yes to. It's a new way of talking for most of us. A lot of us have probably never heard of it, but it works really, really well. Uh, you get good at it. You can use this at home. You can use this to buy a new car on your own. You can use this to get that new raise at work. Whatever, you get good at it and it works really well for you in all situations, but it's something you have to practice. If you're really, really good at it, you can use it on somebody who uses it and they don't even notice it. Uh, I was going out and I was going to buy a new car, and this is going back to like 2015, but I was buying a new car. My wife and I had decided this is the car that we're going to get. We're going to go with used. At the time, we were listening to Dave Ramsey, and he was going to help us get out of debt. And so he said to buy a used car. So I'm going to buy this used one that was low in mileage. The price was right. I knew what I was willing to pay for it. I knew what I was willing to do to take for my car. All I had to do is go in and sign the paperwork. So I went in there on a Monday morning, and it's a cold, rainy, not a great day, but it was a cold and rainy day. And I went in there to buy this car, and I walk in, and as soon as I walk in, I glance at one of these new showroom cars, and as soon as I do, one of the dealers came up behind me and scared the bejesus out of me. He said, "Car's a beauty, isn't it?" And I about jumped through the roof. And when I came back down to earth, I said, "Yeah, it's a beautiful car. Of course, it's a beautiful car. It's in the showroom. It's got 0 miles on it. It has no dust, no raindrops. It's in the showroom for a reason. Of course, I'm going to say yes." He introduces himself to me, asked me what I'm looking for. I told him that I wanted to take that SUV out there for a test drive, and he said, "Oh man, I am so sorry. The dealer who worked last night took that out for a test drive with somebody, and he accidentally brought home the keys. He's on his way back in. He's about 20 minutes away, and if you just want to have a seat, as soon as he gets here, we'll take it for a spin." So I sit down and I'm scrolling through Facebook, and about 5 minutes later, he comes back, and I'm already bored because I'm scrolling through Facebook, and it doesn't take long to get bored. And he says, "Hey, I was just thinking, somebody just took this new car. I know you were looking at that one in the showroom. Somebody just took that out for a test drive. I got it up front still. The plates are on it. It's warm inside. You want to take that? It's the same one as the one that you're interested in, just a couple years newer." I said, "Cool, let's go." So he said, "You'd like to do that, wouldn't you?" And again, do I really want to sit there and scroll Facebook? I know I'm already bored. So I said, "Yeah, let's do it." So we hopped in the car, we start driving, and he's talking about all the features. And then he says, "Car drives great, doesn't it?" It's got 11 miles on it. Of course, it's going to drive great. So he's talking a little bit more. We get back to the dealership. He says, "What you think?" And I said, "I liked it." And I said, "Do you think that the other guy's back yet with the other one?" And he said, "Sure, let's go take a look." Came in, started it up. The car was cold. We're driving in it. We get back, and he's doing the same thing. It drives great for an older car, doesn't it? And blah, blah, blah. We get back, and he looks at the price that I'm willing to pay for it. He's like, "All right, that's good." I said, "Well, how close are we to that other vehicle?" And he said, "You really liked the new one, didn't you?" And I said, "Yeah, it was a nice new car. Said, if we can get somewhere close to that, you'd like to buy that car, wouldn't you?" And I said, "Yeah, if we could get close." He goes, "All right, well, let me go back to the office and let's talk. I'm going to talk to my boss, and I'm going to see what I can do." And he comes back about 5 minutes later, and he says, "Dan, I got great news." I said, "Yeah, what's that?" I said, "Do we have a deal?" He goes, "Oh, no, 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 no. For that price in the new car, I can't get that." He said, we're too far off." I said, "But I could do that for the other car." I said, "Well, how far off are we?" And he said, "Well, we're looking at about this much money, and it'll probably be about this much more. It's going to be $100 more a month for you. You can afford an extra $100 a month, can't you? For a brand new car, that's not really that bad." So I start thinking about it, and it's really what, one date night a month. We're married. What does a date night mean? Every night's a date night when you're with me. So yeah, I could afford $100 a month. It's $25 a week. That's not bad. So sign on the dotted line, start driving home, and I figure, oh my goodness, he used N apostrophe T on me the whole time. I teach it, I use it, and I fell for it. You got to practice it. You got to get good with it. And it's such a great way. So tonight, You go home, honey, I had a long day at work. I'm tired. We can go out for dinner tonight, can't we? Or you can give me a foot rub tonight, can't you? It's got to be stuff that we practice. Continue to make collaborative statements. How can we rectify this? What can we do to make this better? And keep the discussion specific to here and now. What happened in the past is in the past. Let's worry about now. Our next one up is verbally threatening. Notice that we're starting to get into a brighter color. We're getting closer to condition red, right? Okay. Now the person begins to focus their anger on a specific person. You listen to me. They make a demand for action. You better shape up. You better start doing your job better, because if my mom falls again, it's not going to be pretty and you're going to pay for it. Making a demand for actions or threat of consequences if those demands aren't met. At this point, we need to call for help, whether that's pushing a panic button, calling our code teams, getting some other people there, or calling for law enforcement to come in and help with us. But we need to realize that at any step now, they can jump up to that sixth rung. They can become violent at any step. So we need to anticipate violence and call for help. Also, maintain eye contact with them. You don't have to be in a staring contest, but watch their eyes. Their eyes will tell you what their next steps are. Yesterday, I was doing I was teaching at a client site, and it was a new program that I haven't taught a lot yet, so I didn't know where the breaks were. I watched my audience and I watched their eyes, and when I started seeing tired eyes, I knew it was time for a break. And I made a mental note. All right, this is where we're going to put our breaks, because this is where the people started getting tired. By watching their eye contact, I could see what they're doing. Here, we got to watch their eye contact to see if they're going to become violent. If they start scanning the room and they're staring at somebody or they're staring at something, could that become a weapon? Sure. Provide honest options. Don't lie to this person, but tell them their honest choices and let them make the decision. Here are your options. This is what's going to happen. This is the consequences for the option, or the options that you choose, but you can make the choice. Okay. Use the buddy system and triangular de-escalation. We're going to talk about those, all three of those actually, avoid cornering, and the next couple of slides. So I'm going to skip those for now, and then as we get to each slide, we're going to talk about them. So with the buddy system, a minimum of 2 people. We don't need to get 5 or 6 or 10 people in that room where it just sounds like buzzing bees. We need 2 or 3 people to come in and help us with the de-escalation. Right? We have our person who's angry. The person with the red face is clearly agitated about something. The person at the front of the triangle is the person who's doing the de-escalation. The other 2 people are simply there to try to de-escalate, or to watch us. They're watching the aggressor, they're watching the person up front, and they're watching the surroundings. Because we want to see, maybe we don't have the person in the front is not having the effect that we wanted. Maybe that person is starting to get worked up. Maybe they don't have the rapport that you do with the person. So if that is the case and we're not having the desired effect, it might be time to switch out. What we want to do is have a nice little code word where the person will come in and, hey, Dan, it's getting kind of hot in here. Can you go check the temperature in the room? Sir, I'm really sorry about, everything that's going on. I'm going to do everything I can to, and we just switch roles, but now she's doing the talking, and she may have a better rapport with this person. She may have a better chance. They may not be mad at her like they're mad at the other person, and give her that option or the opportunity to de-escalate. So when we're talking about cornering is to trap a person. If we trap a person, their natural fight or flight instinct kicks in. So remember cornering, and remember not to do it. Remember the acronym CAPE. First one is contact. Any unwanted physical contact is contact cornering. So you come up and you put your arm on them, or you put your hand on their shoulder. They don't want to be touched. Right? They push you away. Hey, throw him out. He made an aggressive move at me. Call the police. He's trying to hurt me. No, he's not. You got in the way. You attacked him by touching him. He didn't want to be touched. Angular corner. When you're trying to talk to somebody and they're running around the room, getting different things and doing this or staring at a phone and they're not listening to you. Or, you're talking to somebody who's in a wheelchair and you're staring down at them instead of being on their level. We're making them either A, follow us, or B, they feel intimidated because of the way you're staring at them, and it may cause them to become aggressive. My eye doctor, great eye doctor. I love him. I've been seeing him since I was a kid. I have nothing bad to say about him except for the fact that he is glued to that iPad the entire time I'm there. If he's not looking in my eye, he's looking in that tablet and he's listening to me, but he's charting at the same time. And as I'm talking to him, and he'll ask me a question, and I'll start answering the question, and he'll just be clicking away on the iPad. And I want to grab him and go, "Hey, listen to me. You asked the question." It's, if I have somebody who's already agitated and we do that, it may push them up the ladder. Psychological corner. You're going to do what I say because I said so. I'm the boss, and you're going to listen to me, or else. It's that or else. You start using psychological cornering, and you're going to back them into a corner because you're going to make them think, all right, let's see what happens if I don't do it. Nobody likes to be told what to do, especially adults. Exit corner. Getting between yourself and the exit. This is something that we do as caregivers. We go into a room and we start talking, or we start cleaning up a little bit, or we're getting a blood pressure, we're plugging stuff into a computer, whatever the case may be, but we're not paying attention to where we are versus where they're at, and we let them get in front of us. And now they're blocking the exit. And if they become aggressive, we can't escape. So if we're dealing with a person who's becoming aggressive and they're starting to be verbally hostile, we want to position ourselves in a way we can escape quickly without having to interact with them physically. Our next step up is physically threatening. The person takes a stance that suggests violence. They get into a fighting stance. They put one leg back. They bend their knees. They make a fist. Come on. They're sitting down and they stand up. They start pacing around. They may scan the area for potential weapons. Think about the weapons that we bring into work every single day. And I'm not talking about something that's going to go bang, bang. I'm talking about things that are in our office that could be used as a weapon. Our coffee cups could be a weapon. Our staplers, our scissors, the stethoscopes that we hang around our necks, the Stanley cups that weigh 583,000 pounds. All right. Those things are all weapons to the hands, in the hands of an aggressor. They may start looking around the room for what they can use. They may make a bluff move towards us. They want to see what we're going to do. They make a move and you flinch. What does that tell you? It says, hey, look, I'm scared. You're intimidating me. You have the power. So, but if we take a step back, we bring our hands up. Does that maybe say that, hey, you know what? I know what I'm doing. I'm trained. Let's not do this. Let's find another way. For us, we have to recognize that this is the critical point. At this point, we are one step away from violence, and everything we have done so far has not worked. So now, if we haven't gotten help, it might be too late. If I can, I'm going to try to get out of the room at this point because they're not de-escalating. We want to switch from our non-threatening body posture, which is, like I said, was feet shoulder width apart, hands up, okay, to a defensive stance where I drop one leg back, point it at a 45-degree angle, and keep my hands up at my chest, but my hands are still open. I'm not here. I don't want to fight. I don't want to look like I'm in a fighting stance. I have my hands open. My hands are here. And it almost looks like I'm putting up the stop signs. Hey, stop. Stop. We don't want to fight. Stop. Right. But now they're here. And that way, if the person becomes aggressive and they make an attack, I can block, I can deflect, I can use my hands as a way to help me say. Start looking for strong side, weak side indicators. We're going to show you some slides here in a minute that help us determine if a person is right or left-handed. But realize if we don't know that person and we can't figure out if they're right or left-handed, 95% of them of society is right-handed. So we want to line up on their left side because it is a less coordinated side. And if they become aggressive, that less coordination will give us a chance to defend ourselves better. And be prepared. Again, start preparing in your mind, start forming that mental plan that says, hey, this person's probably going to attack me. Right? If that happens, this is what I'm going to do. Again, like I said, now at this point, if you can discontinue this de-escalation and get away, it might be a good idea to do so. So now when we're looking at strong side, weak side indicators, most men, and this starts off with most for all of these, because there is no 100% tried and true guarantee that we're dealing with human nature. Nothing is 100%. So most men carry their pens, pencils, cigarettes on their weak side. Think about the clothing that we buy. We have one pocket in our dress shirts, and it's usually on the left side because they know that most people are right-handed and most people carry their pens on their left side. I have a coat that has a pocket on both sides. The left side pocket is unbuttoned, and I put my cell phone in it when I go for my walks. The right side has never had anything in it once. Men will carry their wallets on their strong side. The tip of the belt usually points towards the weak side. Most women carry their purse over the strong side shoulder. And again, this is so you can defend yourself if somebody comes and take it. It's almost instinctual. I don't know about anybody else, but I know if I put my wallet in my left hand in my left back pocket, it feels weird. It doesn't feel right. The whole time I feel like I'm off. So again, everybody's different. There's no 100% tried and true, but these are just ways to help us realize. And again, most men part their hair on their weak side. Most people wear their watches or fitness trackers on their strong side. On their weak side. This is one that is pretty reliable. If I see somebody with an Apple Watch or a fitness tracker or any of that kind of stuff on, I automatically assume that their opposite hand is their dominant hand. Most people will stand with their strong side shoulder dipped a little bit lower. Most people will stand with their weak side foot facing forward. If they take a step into some kind of a defensive or fighting position, watch what foot they step with. If their weak side, if their left foot is up, that's most likely their weak side. Most people will carry their their pagers and their cell phones on their strong side. Not a lot of people carry cell phones on their sides anymore. So that one may not be too accurate. Again, if you're unsure, line up on their left side. Our next step up is physically violent. The person attacks us in some form, whether it's they throw something at us, they bite us, they scratch us, they push us, they punch us, they attack us in some form or another. Our mode now is to change from a self-defense to a survival mode. We now are just trying to escape from this violent situation. We're not still trying to talk them down. It's time to get away. Remember, when we're talking about self-defense, it means it involves any and all means of self-protection. The force that you use must be reasonable and necessary. We don't want to turn into an aggressor. We see that, we hear about it a lot where a person is pushed so far, then the person becomes aggressive and then they get the upper hand and they become violent, we don't want to be that person. So it must be reasonable and necessary. And if we go outside of reasonable and necessary, we could be criminally liable. So, as an example, I always give: if a person goes to take a swing at me and they punch me, or they punch at me, and I deflect it with my hands and knock them away, and as a result, they fall and they land on their hands and they break their wrists. Did I do anything wrong? No, I protected myself. They fell as a result of their punch. I did not do anything to cause them to injure their wrists. But if I jump on top of them and I start slamming their head into the ground afterwards, did I just become the aggressor? Yeah, I took it too far. The tactics aid in the escape of an individual's attack without regard for the attacker. Again, I'm going to use what I need to use to escape. Right? And this is sometimes hard to do because they could be our residents and they could be people that we know and that we love. But if we don't escape from their attack, we're going to get hurt, injured, or killed. And this is only to be used in an emergency situation. And we're only going to use the level of force necessary to escape. We're not going to turn into the attacker. We're going to escape. They grab my wrist. Do I need to do some big fancy move that's going to hurt them? No, I need to lift up. I need to pull my hand towards their thumb, get away, and take a step back. If they're holding my hand because they're scared, do I need to do anything to get out of it? No. But if they grab my shirt and they're starting to pull me down into the bed with them and they're going to hurt me, do I need to get out of that quick? Yeah. How can I do that? Well, I'm going to apply a different technique. It's not going to cause a lot of pain because I don't want to hurt them. I put them down, I put their hand down, and I get away. Again, force is judged by the standpoint of a reasonable person or security officer with similar training and experience. So if this were to go to court and you were to sit on trial, they're going to ask you what you did. It's all going to be documented. And then they're going to bring in somebody who has similar training as you, and they're going to ask them the same thing. Would you do this? And then it's going to be judged from there. It's also judged through the eyes of the person at the time. So as we're starting to wrap up a little bit, if you have questions, again, please put them in the chat and we'll get to them at the end. I'm going to leave plenty of time for questions, but we're going to start to look at these 10-day escalation tips to apply and a couple other ways of review, and then we'll get out of here in a few minutes to answer questions. So first one is commit to an outcome. I'm going to do everything in my power to provide the best customer service possible, because as I said earlier, the better customer service I give a person, the more likely they are to stay calm. When I see a person come in and I think, oh my gosh, you're here again, I can't say that. I'm going to be caring and loving and inviting to every single person that walks in. Pay attention. Know what's going around us. Know what's happening as we're trying to de-escalate this person. Know the aggression continuum. This person is not going to immediately de-escalate or go back down to physically agitated, or verbally agitated rather, just because you walked in the room. You need to see it, recognize where they're at, and say, this is where they're at. This is what I need to do in order to bring them back down to a level of calm. Next is assess the cause. What caused them to become agitated? What caused them to become violent? Was it something I said? Did they come in angry? Did mom and dad upset them and then they came down here and took it out on us? What caused this problem? Okay. Avoid ego battles. We don't want you're going to do this because I said so. Save that for at home with the kids. It's easier to win. Monitor your own status. It is possible for your champagne bottle to get shaken up. Monitor the environment. What's going on around you? Excuse me. What's going on around you as these people are escalating? As you're trying to de-escalate, could somebody else or something else be going on behind you? Offer honest options and choices. Do not lie to the people. Once you lie, you lose all credibility and your chances of building rapport. All of that stuff is shot right when you lie to them. So offer them an honest choice. Let them make the choice. Avoid cornering. Remember CAPE. And remember who's in charge. Right? And when I'm talking about who's in charge, I'm not talking about who's in charge of the company or who's in charge of your home, who's the head nurse or any of that stuff. Who's in charge of this de-escalation? The person in charge of a de-escalation is the person who's talking to the resident at the time. If I'm talking to that resident and somebody else comes in and starts going in, and I could be close to de-escalating, but somebody else comes in and starts barking orders, could they turn around and increase their aggression? Absolutely. Just because they are a leader or a boss or something like that doesn't mean they're in charge of that de-escalation. It's the person who's talking at that time. And the reason we do that is because the person who's talking is the person who's likely going to get attacked if the person becomes violent. So if I'm talking to them and I'm not having the results that I want, and the person behind me comes up and says, "Hey, let's tag out." Again, it's not an ego thing. So I'm not going to tell her no. I'm going to back away. I'm going to let them go. And now now she's in charge. Some nonverbal clues, sudden movements, like we talked about. They're making those bluff moves and trying to see what we're going to do. Tightening of large and small muscle groups. You start seeing them clenching their fists. You see them rocking their shoulders, okay, getting ready to go for an attack. Twitching facial muscles. You ever see a person when they start getting stressed, their eye twitches? Uh, that happens to me when I'm at home and I'm dealing with the kids or I'm arguing with my wife or any of that fun stuff. I start getting stressed, my eye twitches. Darting eye movement. They're scanning around the room. Could they be looking for something? A fixed stare. If they're fixed staring at you, they're trying to intimidate you. They're also telling you that if I become violent, you're the person I'm attacking. They may glance for weapons. Think about what is on you at the time that could be a weapon. Do I have that stethoscope around my neck? If I do, maybe I should take it off and put it in my pocket. Maybe I should toss it out of the way. Maybe, what else is around us? Do we have a stapler? Do we have scissors? Are we at my desk where there's a lot of different pens and pencils and all that stuff that could be used as a weapon? Shifting in balance or changing in stance. If they're sitting and they stand up, that's a pretty good indicator that they're getting aggressive. Raised voice and increased volume. You may see them start talking louder and they start yelling. What is almost instinctual for us to do if they start yelling? We start yelling, right? We start talking back. They get louder, we get louder. They get louder, we get louder because he who with the largest mouth wins. It's actually the opposite. They get louder, we should lower our voice and make the volume balance in the room one to where they have to come down to match ours. Because as they come down, they also lower their aggression a little bit. Yeah, we talked about changing in stance, increased breathing rate. You see them start taking those big, deep breaths. All right. Now they're trying to get more blood flow into their body and more oxygen to their large muscles because they're getting ready to attack. Instead of giving orders and choices, allow them to make the choice. Don't give them orders. When I was very young on the fire department, I had a fire chief who would tell, when instead of barking orders for us, "Hey, Dan, my buggy's running low on fuel. Can you run around back and fill it up for me?" Or, "Hey, could you go take out the garbage for us? The bathrooms need cleaning. Do you mind going and cleaning those for us?" He never told us what to do. And one night I asked him, I said, "Chief, why do you do that?" He said, "You're the boss. Why do you tell us what to do? Or why don't you tell us what to do instead of asking us?" And he said, "Dan," he said, "you're an adult, right? You want to be treated like an adult?" I said, "Yeah, absolutely." "How do you feel when you get told to go do something?" I know he goes, I know I'm the boss. You know I'm the boss. So if I tell you to go do something, I make you feel like a child. But if I ask you to do it, then I give you that choice and you get to make the choice. And you know, since I'm the boss, that you're going to make the right choice. And if you tell me no, there's going to be a really good reason as to why. And maybe you're in the middle of something I didn't notice. So you have the ability to tell me yes or no, but I know you're going to go do it because I'm the boss. And it changed the way that I thought. And that, when I think about it this way now, I'm not going to tell somebody to sit down and be quiet. I'm going to ask them, can you have a seat for me? Can you do this? Can we go over here and talk? Don't project that I don't give a darn attitude and allow the person to save their self-esteem. Don't overstare, but do maintain eye contact. Overstare is threatening. Again, don't argue with the person. Give them their options and let them know their consequences for each option. Sir, unfortunately, if you don't lower your voice, we're going to have to ask you to leave. And if you leave, you're not going to get to see your mom today. We're going to have to come back at a later time. You want to see your mom today, don't you? You can lower your voice for me, can't you? Those are their options. Either lower your voice or don't. Asking it in a way of in a posture routine, getting them to say yes and agree with me. They may lower their voice. They may come back down to a level of calm because they're coming and you're asking them rather than saying, hey, you need to stop yelling at me. Don't talk to me like I'm a child. Don't turn your back or walk away from the person. Once you turn around, even if you think you know where you're at, or you think you've de-escalated the person, you turn around, you don't know what's going to happen. Right? Remember to maintain a safe personal distance, at least one arm's length. Monitor or don't become emotional, monitor your own status. And don't invade the person's space. Give them that distance. Right? And line up on their weak side. We talked about don't raise their voice, don't get louder. Don't make threats. Stay calm and relaxed. And take your time. And this is one of the things that I've heard so much, and whether I'm if I'm at a client site or I'm working with a new person teaching them this, or I'm uh, on the ambulance. You know, we have other things to do. We don't have time to sit there and talk to this person, and we don't have time to keep coming back and de-escalating. So we're just going to throw them out, or we're going to just do this, or we're going to do whatever. If I don't have time for that, how am I going to have time to do everything that follows, trying to have them removed and the paperwork that comes up with that and the consequences and all of that other stuff? Spend the time necessary for a good de-escalation. It's worth it to avoid getting injured. If you are involved in a violent incident, first thing you should do is get any medical attention necessary. Take care of those owies and those boo-boos. Report the incident to your supervisor. Fill out the proper work paperwork, the accident reports, and then document everything and be as specific as you possibly can. If this went to court for whatever reason, it doesn't happen overnight. It's going to be days, weeks, years, months down the road. Write it down and be specific. Use the same verbiage that they used against you. He grabbed my shirt. He pulled me to him and he said, I'm going to break your, if he cusses, then add that in there. Paint a picture of everything that happened. He was so close as he was yelling at me. I could smell his breath. His spit was coming out of his mouth. He told me he was going to break my effing face and everything that goes along with that. Just paint the picture so the people there understand why you reacted the way that you did. Also, make sure you talk about these situations. They are scary. They are threatening. This isn't something you just go, man, that was a bad day. All right, well, I'm going to go home and shake it off with a cup of coffee and a warm shower. No, this may stay with you for a while. It's scary. Talk about it. Watch for signs of PTSD. There's no shame in saying, hey, I'm having a hard time. I need to talk to somebody. Utilize your employee assistant programs. They're there for a reason, and they're here to help us. At this point, I will answer any questions. I know there's a couple in the, I see I have 3 comments in the chat. So Brittany, do we have anybody? Any questions?
No, not necessarily that I see, just so people putting their names in the chat so I can
Okay.
count them for attendance. Does anybody have any questions for Dan? So we can talk, is there anything you wanted him to expand on a little bit? If so, put it in the chat or raise your hand or just speak out. We're happy to hear any questions. No.
Well, I know it's
Okay.
sometimes hard to think of questions right off the top of your head, if they didn't come to you when we're doing it, but they may appear later. So that's why my email is on there, dwilder@SWA Force Safety. There's also my phone number. Please, if you think of questions later, do not hesitate to give me a call. Drop me an email. My phone is on me 24 hours a day. I don't sleep a whole lot anyway. So please feel free to call me 2 o'clock in the morning or whenever.
That sounds
Brittany,
good.
thank you very much.
You're
It was a
welcome. And
great
everybody, I
session.
will be sharing the PowerPoints with you as well. So yeah, we'll send that out as well as your CEU certificate. So if any of you guys do have questions, feel free to send me an email as well. And if you have questions, I can forward it on to Dan. Thank you all so much for being here. Again, Dan, thank you so much. I really enjoyed this presentation, and thank you all for being here. Have a wonderful day, everybody.
Thank you, everybody. Thank you.